are used to taking care of fragile people. In the ICU or critical care, typically the patients are at their most vulnerable or their sickest state. Prior to COVID, we were able to respond in very calm and very organized fashion. Now that we have COVID and we're spread amongst 3 floors, it's madness, because you could have a code blue on the 4th floor and you could have a code blue on the 6th floor happening at the same time. Our 2-to-1 patient ratios are now 3-to-1. The ability to give that care that we once could give is gone. There have been many times where the nurse is in her PPE in one room doing patient care, and her patient crashes in another room next door and she has no idea. I was one of the volunteers in the beginning who took these patients. I was shocked at some points how the doctors wouldn't come in the rooms. Why are you throwing us to the wolves? Now I need to be in there turning my patient myself, suctioning my patient myself, adjusting ventilator settings myself. That's it. We did everything. Because healthcare has turned into such a corporation, and it's turned into a money-making problem, that they've lost touch with what we really do at bedside. We know more than anyone else what we're fighting against. Don't start directing how we need to do this without being down there in the front lines and seeing how hard it is. You can't come down in a suit from the top and make waivers for changing of ratios and, make decisions without being there. Watching us sweat under our PPE, watching us cry as we're trying to save 40-year-old patients and watching them die. There's no other recognition for us but candy. A box of candy hand-delivered by our CEO. Suckers, which is very appropriate when you're wearing a mask. A few weeks ago, I was taking care of a 41-year-old man, and being 41 myself, it was hard to see that he was so sick and with no real underlying health care issues. He was a relatively healthy guy, not obese, lean, and he didn't do well. And when I came on, I had him for a couple days in a row. We had allowed his family to come in and see him, and I know that he had coded the night before and he wasn't looking good on the ventilator, but we were obviously still trying to do the best care we could for him, because his spouse wanted him to keep going for obvious reasons. But the hardest reason was when she came to visit, is they had a boy turning 4, and I have a boy. And seeing her face outside the room while I was doing chest compressions on her husband. A young man, essentially my age, multiple times when I knew the outcome wasn't good. And finally stopping and telling her there's nothing more we could do, while she sobbed and screamed. As I faced her, knowing they had a little baby at home. That was a few weeks ago. I don't think I'm over it. Especially when I had to go back and do the same thing to another guy this week. I just wish I were tougher about it. For Christ's sake, I had to go on antidepressants. It's horrifying. We see death all the time, but if there's a culture in nursing that's what we do, so we can handle this. And when it's incessant and we can't fix it, it's probably I think our biggest nightmare as a nurse, because what we want to do is make positive changes for people, and we can't. It's impossible. It's impossible. There's too many people. There's too many sick people, and these are sick people. I have the girls who work themselves to the bones, that don't have kids and don't have families, and they're there 5 to 6 days a week. And these girls are amazing, passionate, caring nurses, and they're just withering before my very eyes. We do, as nurses, suffer from PTSD. You can't go home and tell your loved ones about it because they A, look at you horrified, and B, they don't know what it's like to be in that. When this was coming, I never thought ever that we would be struggling for basic things like PPE. Why? Why here in America were we struggling for things like that when we were watching overseas in China in their full, gear, and standing here, these poor girls in New York in trash bags? Why? This pandemic has been done wrong from the beginning. I've been embarrassed by what the American healthcare system is. This showed we have a need for socioeconomic help for people who are in underserved communities, because they're hit the hardest. Why in this country are we watching these people suffer because they don't have access to basic health care? We are really good at what we do, and we still have a passion to make people better. We're not whining. We still want to do this. When we are trying to make the reality of COVID come to light, it's because we want to protect you. And we want to protect our loved ones. It's made the people who work together, I feel, come together because we've relied more heavily on each other than we ever have before. I'm proud of us. We are some badass group of people from all over, all areas of nursing, all areas of healthcare. Rather than being healthcare heroes, we've built this underlying thread of connections from coast to coast. And if I didn't feel like hope that there was an end to this, I don't think I would keep going.